I am Dr. Ramakanta Panda, Chairman and Chief Cardiovascular Surgeon of Asian Heart Institute, Mumbai. See, what I see is mostly lifestyle related. When I say lifestyle related, it's everything. It is lack of exercise, the type of food they eat, the stress level they take, also the alarming use of tobacco in various forms, so that it is chewable tobacco or smoking or all types of harm. And that when it couples with the lack of sleep or sleeping very late at night, everything has combinedly contributed to this heart disease. When I said the first one, what I meant is people are not doing any exercise. Everybody is on a computer or on internet or one of those things, a mobile all the time. Then food habits has completely changed from a food which is natural based, which is good for the healthy for the body. People have started eating all ready-made and fast food, which is very high in what you call the saturated or bad fat, in salt. Also, it is very high in the processed food, which gets absorbed very quickly in the body. So sugar level goes up very high, and that indirectly all these things contribute to alarming rise in high blood pressure and diabetes among younger people. That also, when you combine that lack of sleep, normally the body you need at least 8 hours of sleep every day. You need to sleep at a particular time. 10 o'clock you have to sleep. Same sleep at 2 in the night, 8 hours is not as good as or as healthy as sleeping at 9 or 10 in the night. When you combine everything, this has caused the alarming rise of heart disease and heart attack among the young patients. Coming back to your second question, specific lifestyle and dietary habits that I'll put it, 4 important things I always say. Number 1 is lack of exercise. Nobody is doing exercise. Everyone has to do it. Today, you want to walk today for 100 meters, people want to use a car. In the office, 1 floor, they want to use a lift. So lack of physical exercise is a very, very common reason why people are having problem. When that you combine that with stress factor. Stress in a continuous basis. Occasional stress is not good for the, not bad for the body. But when the stress levels are there, a continuous basis, whether related to work, related to aspiration, related to everything, that is bad. So when people, and third thing is, it's very important also, is the type of food we are eating, which I already explained. Earlier, our previous generation used to eat all complex food, which was made from the natural ingredients, bring in and cook in the home and eat it. Like say jawar, ragi, bajra, or if you are eating vegetables, salads, etc. These are very, very healthy for the body. Today, everything ready-made. Either you go and eat a pizza or burger, or go to fast food restaurant, quickly pick up something to eat for your lunch and breakfast or dinner, or ready-made food is there, just cook it, eat. These are extremely bad for the health because it has all the wrong things that is needed to damage the body. And especially when you eat this stuff, not only they are very high in calorie, you put on weight, very high in sodium, and also very high in bad fat, which damages the blood vessels in the body. And when you eat them, they get absorbed very quickly. What happens? Sugar level goes up very high. And obviously, body has to secrete, the pancreas has to secrete insulin to get the sugar down. When repeatedly the pancreas starts getting insulted like that, they start getting damaged. So over time, overweight, lack of exercise, that coupled with smoking, everything leads to high blood pressure, diabetes, all these factors leading to high incidence of heart disease among younger people. The way I see if you look at it, the economic condition has improved. 100 years back, average person in the world and including India was having 1 meal a day. From 1 meal a day, we are having 3 meals, which is good. But again, we are having, because people are able to afford the type of food they eat. They are all eating extremely unhealthy food, which is very, very bad for the body. Then additional income, but in also other bad habits like smoking, alcohol, they also damage this one. So what I've seen is, if you look at it, even 30 years back, the heart disease incidence in rural India was less. With economic development, slowly you see the heart disease incidence, high cholesterol, diabetes, blood pressure, Incidence in rural India also climbing up. My opinion, in few decades it will be almost similar level that of urban India. So coming back to question, the social and economic concern that has affected, certainly it has affected the upward mobility and economic improvement that has taken place. Definitely indirect has adverse impact on the heart health of the young people and of the entire population of the country. Absolutely. What we have realized, every country has realized, no matter how rich or poor country, that waiting for the person to develop a disease and then treating is 100 times more expensive than preventing the disease. That's why the entire focus should be now from disease management. That is, a person develop a heart problem, develop a lungs problem, you treat, versus health management. That means managing the health of the person, educating people what to do, what to eat, how to do lifestyle change, exercise, etc., so that they lead a very healthy life, so that they don't develop disease. That is much more cost effective. You save a lot more money. Not only the population stays healthy, and overall country prospers better. So the entire focus should be from disease management to health management. Though there is no specific study, but enough other studies to show that air pollution are two. One is particulate matter, one is all the gases, etc. It has definitely adverse impact both on the heart and lungs. There is high incidence of heart disease as well as lungs problem. Lungs is very, very common. We know that because both gases and particulate matter goes into the lungs, damage the lung, and the chronic obstructive airway disease, interstitial lung disease, all kinds of lung disease incidences are very high in urban areas. Heart also is not immune from pollution, because all these noxious things that we inhale also directly, indirectly damage the heart, the arteries in the body. They harden the arteries. So the incidence of high blood pressure has been shown to be increased proportionately to the incidence of pollution. So when person develops a high blood pressure, that is also one of the major risk factors getting heart disease. So though at this stage there is no direct correlation, but there is enough indirect correlation to suggest that air pollution is also a significant risk factor for heart disease and lungs. And the amount, there is all these noxious gases there, carbon monoxide or nitrous oxide, all the carbon monoxide level that is there in a polluted city like Mumbai or Delhi, equivalent to smoking 10, 15, 20 cigarettes a day. So that is as bad as smoking cigarettes. So if smoking cigarettes is damaging heart and lungs, this is definitely damaging heart and lungs. So even though there is no scientific evidence directly showing that, there is enough indirect evidence to show that air pollution has a significant adverse impact on heart and lung diseases. And people are developing earlier heart and lung diseases because of the high air pollution.
So what are the precautions they should take while doing the exercise or going outside?
As I said, the 4 things I always say to everybody: exercise, number 2, take proper diet, number 3, reduce stress. Now both ways, doing exercise itself also reduces stress. You can do yoga, which is very, very good in reducing stress. 4th is sleeping. People have not realized till now that sleeping also is very important part of keeping healthy, whether it's heart health or lungs health or whole body health. Sleeping 8 hours a day and sleeping before 10 o'clock is very important. So I'll strongly suggest everybody to do these 4 things that can help, and people's mindset should change from waiting till they develop disease to health management. That try everyday lifestyle you lead such a way that you lead a healthy life, so that you don't develop disease. That's why my favorite quote, I say that if doctors and medicine could cure and prolong life, the richest people on earth will be living 150, 200 years. They don't live. The people who live 100 years are the people who lead a very healthy lifestyle, not because of medicine or doctors. Unfortunately, in urban life, the space is so limited now. There is not scope or place for doing physical activity. But same time, I'll recommend or suggest everybody, encourage everybody to be built in consciously, subconsciously, physical activity to day-to-day activity. Just like the way beginning I said, suppose you are going car, don't take a car for a half a kilometer, walk 1 kilometer. In office, instead of taking a lift, climb out 2-3 floors. And whenever possible, try to build in some amount of exercise. No matter how busy the people are, I always tell them, you can, even the busiest executive CEOs, I recommend that build up a small little gym right next to your office. You can, while running on a treadmill, you can dictate. I'll show you, you can take the video of my office. I've got a exercise area right next to my office. Quite often while I'm conducting a meeting with my staff, I'll be running on a treadmill for 15-20 minutes. So there are ways, if you are sincere and conscious about it, everybody can build in certain amount of physical activity, no matter how busy they are, no matter how much less space we have in the cities. The entire treatment, see, there are multiple things. One is on the intervention side, but more important, first I'll talk about prevention. The biggest thing that's coming out, how to prevent heart disease. And whether it's, as I said, lifestyle change coupled with other diets, etc., etc. Number 2 is the investigation. So investigation also is slowly getting less and less invasive and more accurate. Third thing is treatment. In the treatment side, we have got medical treatment and intervention treatment. Medical treatment also, newer drugs and newer medicines are coming out, which is improving the I'll give an example, the medicine to reduce cholesterol. 20-30 years back it was not there. Today it is this medicine to reduce cholesterol significantly affecting reducing the incidence of heart disease, to the extent that all this lifestyle change, medication, etc. has reduced the incidence of heart disease in the United States by more than 25% in 10 years in the past 2 decades. So, and the fourth last one is improvement in the type of treatment we do. The focus now on heart treatment is going from invasive treatment to less and less invasive. Like we still cut, when you do a heart surgery, you cut up on the chest, make 6-8 inch incision, but slowly focus is going from how to make it less and less smaller cut, or we are doing non-invasive. Now a lot of valve replacement can be done without surgery. Till 10 years back, every single valve surgery has to be done with cutting the chest at the front on the side. Today, a lot of valve surgery can be done from the leg through a catheter. And with a small little, you just put a needle and put the catheter through that, put the valve, the patient goes home in 3 days' time. So the entire treatment today is going more towards non-invasive treatment, going more towards getting newer medicine that can help a person recover from heart disease. Third thing is more important is from waiting for the heart disease to develop to leading a lifestyle that can reduce the incidence of heart disease. That's the last one always I focus. Don't wait till you get a heart disease. Lead a lifestyle so that you don't get heart disease. Even those who get heart disease, I always say there's nothing to get worried about it. If you still change your lifestyle, you can almost get back to a normal lifestyle. Life is getting more competitive, world is getting more fast. While doing that, again, repeatedly, I'll tell that especially youngster to look after health. Now, 30 years back when I started practice in India, once in a year, I'll see a patient who is below 30 years of age. Today, every single week, I'll see 4 or 5 patients. Almost every day, I'll find a patient who is below 30 years of age. And 30 years back, somebody 35, 40 years of 30 years of age will come with a chest pain. We'll say, no, it is not heart related, don't bother about it. Today, when a youngster, 15, 20 years or 25 year old comes with a chest pain, we always try to check it out, make sure that he doesn't have heart problem. So this is what happened in one generation in 30, 40 years. And the way we are doing, unless we change our lifestyle, we are going to see more and more youngsters getting heart problem. It has become rampant if you see last 5 years. It's going to get worse. So my message to all the youngsters is, the best treatment for you is in your hand. The most important treatment is exercise. Nothing like exercise. Whatever way, try to build in some amount of exercise to your daily routine. Number 2, eat healthy. And number 3, sleep at least 8 hours a day, sleep before 10 o'clock. And yes, life is full of stress, but try to learn how to handle stress, do yoga. Do these 4 things, chances of getting heart disease is minimized.